Nationwide, Americans are dissatisfied with healthcare. A recent Harris poll says more than 70% of Americans feel the system is failing to meet their needs in at least one way. A family I spoke with in Southwest Virginia agrees and says they wish we had more resources in our area.
There's a bright side.
In Russell County, Virginia, Pam Ray and her 30-year-old daughter Victoria find peace in faith, family, and music. But they say life hasn't always been easy.
Victoria has chronic epilepsy, and she also has mental health issues that go along with it.
Ray says they choose to drive 4 hours away multiple times a year to UVA to get specialized care, a situation that's not unusual with rural hospital systems. According to the National Library of Medicine, patients in rural areas travel 2 to 3 times farther to see medical specialists than those living in urban areas.
We have primary here for if cold or she cuts her finger or something like that, and some mental health services, but everything else has to be done away from here.
They say that can be not only mentally straining, but financially as well.
It is a financial strain because we have to pay to get to go up there. We have to pay, to drive. We have wear and tear on our automobile. We have to eat. We have to stay somewhere. You can get some discounts and get some help.
News 5 decided to take to social media and ask how our viewers feel about healthcare in the region. The non-scientific results were overwhelming. 1,500 comments in less than a week, and personally, I had more than 100 messages and emails. There were concerns on staffing, ER wait times, pricing, and billing. Tennessee Senator John Lundberg hears those concerns, but says he supports Ballad Health in the 2018 merger.
Candidly, we have great healthcare in the Tri-Cities. And I think if you look at the surrounding areas, if you look across Tennessee, North Carolina, Virginia, you'll see healthcare systems that are really struggling. You've seen in Asheville, the Attorney General of North Carolina is filing suit against HCA up there.
A Forbes advisor team recently performed an analysis of 24 metrics from 3 government databases to create a report on the best and worst states for healthcare. They looked at healthcare access, outcomes, cost, and quality of care. 7 of the top 10 worst states for healthcare are in the South, including Georgia, Alabama, and North Carolina. Virginia and Tennessee were number 16 and 20 on the list. Senator Lundberg believes that without a doubt, Ballad saved rural hospitals and were better for it.
One thing that it's implausible, you can't do it, go back 10 years and say, let's take Ballad out and have now 2 entities. I think the problems would be huge, and people would say, boy, I wish you had created a merger between Wellmont and Mountain States. I don't think Ballad gets the credit in many ways it's due. That's probably not a popular thing to say, though, with a lot of folks, but it's true.
President and CEO of Ballad Health, Alan Levine, says they're also aware of concerns and take them very seriously.
I can't be everywhere all the time. We have over 1 million patient contacts a year. And I can't be everywhere that 12,000 other people are all the time. And so, but what we try to do is instill to our team members a sense of, these are your neighbors. This is your family. These are people that are trusting us with their care. Give them the best you've got every day, every time, every interaction. We don't always get it right, but the goal is to get it right all the time.
A bill introduced this year in the Tennessee General Assembly takes aim at Ballad Health and seeks to repeal the law that allowed the hospital system to form. The House bill, proposed by Representative Gloria Johnson out of Knoxville, calls Ballad's Certificate of Public Advantage a failed experiment and says the law granting it effectively allowed monopolies to form in East Tennessee. Ballad argues the bill makes inaccurate statements and, if passed, would result in hospital closures in the region. Victoria Ray has been through a lot in her 30 years of life, but even still, she stays positive and is always smiling. But her mom says she will keep fighting to ensure Victoria has the best possible care.
We need good services, medical services here, and we need them urgently in our area. And we've wondered sometimes if we shouldn't move closer. And we will do anything we can to help her out. But we want to stay here. This is our home.
We've had an overwhelming response on the healthcare stories in our region, and we want to know what you think. You can scan this QR code that's on your screen. Your responses may be used for future stories here on News 5. A correction to a story we first brought you on News 5 at 6. And my story about the GI doctor shortages in our region, the correct name of the group referenced is Gastroenterology Associates and is not associated with Holston Medical Group.